Welcome, friends, and thank you for tuning in to another episode of the Optimal Health Program. I hope you're all doing well. Today we're going to talk about a variety of things. We'll talk about inflammation because this is a new buzzword that everybody hears, yet doesn't really understand. We'll talk about some interesting studies on how cocoa extract can lower C-reactive protein and may be beneficial for your heart. We'll certainly be taking your questions. For those of you who would like to call, 1-888-420-9272. Otherwise, you can hit us up through any of those platforms. Big announcement. On Saturday, we reached 180,000 views on LFA Rumble.
Let's go.
Unbelievable. Never thought numbers could be so good, but 180,000 views was pretty cool. And lots of emails to the office, and certainly we'll go over a lot of those today because it really covers a variety of the things that people are having problems with, whether it's hormonal or hair loss or joint pain or back pain. So my idea has always been to talk about as many different things on each program as I can. Many years ago, doctors, including Dr. Atkins, rest his soul, who was a very nice guy, I used to go to his office the first Monday of every month and meet with other doctors and talk about protocols and things, would do a show on a specific topic, but to an extent that limits the number of questions or people that might want to be listening or watching. So you want to be able to cover as many things as possible. That's what I've always done in 35 years of being on the radio and now a few years being on doing the podcast. So very excited to see that our numbers are climbing up and up and up. Okay, let's see. Do we have a couple of questions?
Just people just joining in. Start
Good.
off on the articles. Let people get situated.
Yeah, so inflammation is a term that everybody uses and sort of indiscriminately. And a lot of times they talk about it for aches and pains. Yes, you could have inflammation in your muscles, your connective tissue, your back, your joint. You could have inflammation inside your blood vessels if you have an inflammatory mechanism or damage, elevated C-reactive protein, plaque progress. You could have inflammation in the lining of your bowel, colitis, or GI disorder. So it can come from any number of different things. And people will say, and I see them in the office, they say, I feel inflamed. Well, how do you describe that? And it could be 10 different things. So when we take your history, when I take your history, and we look at your blood work, and we look for inflammatory markers like C-reactive protein, a variety of things, we can get a good handle on what your body is doing. So some people take an anti-inflammatory for inflammation, and they feel that that's kind of covering what their chief complaint or their symptom is, but it may not be covering an elevated C-reactive protein or a vascular problem or something in your gut. So we have to look at each of these in a slightly separate position and make sure that each one of these things is being corrected by suggestions made based off your blood work. For a lot of people, inflammation is caused by allergy to a food, a chemical, a GMO food, or an inhaled allergen. Yet for other people, it could be from a virus or heavy metal exposure. Some people that don't have appropriate hormone levels, the hormones aren't there to do their job in the organ or cellular-wise, and that impedes the normal enhanced process of fine-tuning your body and the metabolic effects. So it can be coming from a wide range of things. And honestly, it's very rare to see a person who has one underlying cause for the problems they present with. And I've been a stickler for this for many years, my entire career. So I'm not just satisfied saying, oh, well, you have this on your blood test. It's only one thing. Let's just work on that. So we have to work on everything that we find that's abnormal. And that's why we do such a thorough blood test. I call it the comprehensive medical nutritional approach because we're looking at all of the nutritional realm, vitamins, minerals, of course, but looking at the medical realm too to see where these issues intersect and where the cause or causes are coming from. So very important to be thorough in that fashion.
Got a question here. Doc, what exactly is inflammation? Is it always bad, or is it the body's normal way of healing process gone wrong?
So there are good components, good mechanisms to inflammation, and there are bad. The easiest one to chat about is that when you go to the gym and you work out and you're lifting weights or you're doing some sort of cardio and you're creating an activity, the mechanism is such that you may be creating little micro tears in your muscles, in your ligaments, your tendons, connective tissues to help to be able to create growth as a second result of that. So that stress or strain you're creating is creating a good response for your body to create healing, bigger, stronger connective tissues, muscle. So there are ways that this, sets up your body for benefit. Inflammation in the lining of the blood vessel is always a bad thing because that can cause plaque. And I think that there are 50 things that contribute to inflammation in the blood vessels and that plaque process. Everything from viruses, low vitamins, minerals, high homocysteine, fibrinogen, C-reactive protein, high cholesterol, low nutrients. The things go on and on. So there are good and bad components. Your body's natural repair mechanism is part of a good process with some inflammatory component. But the negative effects of virus, heavy metal, all of these things would be a bad part of that inflammatory cascade. So you want to control that. You want to shut down the bad and amplify the good.
Got someone on YouTube that just said they saw you on the Rumble homepage this weekend.
Oh,
Congrats.
Cool. Thank you.
That was...
Yeah, we were really excited. So, we didn't know what to expect. Rumble's an amazing platform, and LFA is an amazing platform, amazing group, and we're obviously thrilled to be able to have the opportunity. So they put us on the front page in the big window. So that's why we got so many great, views.
Nice to not be censored.
180,000. Yeah, nice to just be able to get out and talk and explain things and talk about what you'd like to talk about. And just as on the other platforms as well, the feedback from people and their questions are great, As I say, being on the radio for the better part of 36 years, taking questions and calls, it's terrific to be able to see that people are more interested, more learned now because they're looking and reading and understanding, and they want that knowledge. They want to be able to make themselves healthy, and they know that it has to start with their desire to become healthy and then to ask the questions, come in, get the testing done, and we can help to bring them there. So, yeah, it's exciting.
Got this question. I always feel inflamed when I wake up. I always thought it was either allergies or when I drink too much alcohol, but what is the deal with waking up and feeling very puffy in the face?
It could be. Your body is a constantly changing mechanism, and it responds to what you, put into it or bring it in contact with. For some people that, let's say for sake of discussion, they're a little bit overweight and they need to lose some weight. It could be anywhere between 10 to 50 or more pounds. Fat cells hold on to water, so when you're laying down at night, your body tends to look or feel puffy because that water is now distributed throughout your entire body. So yes, you can get puffy eyes. Those individuals, when they're walking around during the day, gravity pulls the fluid down and typically will have either some swelling of their feet or their ankles. But when you're lying down, that fluid can redistribute. So that may be part of it. It could be an allergy mechanism where you're eating something and a few hours later, the antibodies build up and start to create that boggy feeling or that, discomfort. It could be anything from brain fog to just aches and pains in the joints, even though you didn't do any, significant physical activity. So there are a lot of things going on in your body that if you have the perfect negative storm, 3 or 4 things occurring at the same time, yeah, you can feel really bad. Your muscles and, your joints could have aches and pains. You could be puffy. And then the other component to that is it affects the way you think and the way you function. So all of those things are possible. That's why, in a perfect world, if we can test that person within that realm of feeling that bad and feeling that inflamed or puffy, then your test will show us exactly what's occurring.
What's the biggest myth you hear about inflammation when you wish people understood better? That you wish it?
The thing that I hear the most is that people say they have inflammation, but they can't tell me what it is. If I sprain my ankle and it's swollen, okay, there's inflammation in there. You're trying to protect a damaged area, but, some people obviously don't want the swelling. They want to be able to function without discomfort or pain, etc. So that's an obvious mechanism. Some people might have inflammation in their blood vessels and not know it. They can't say my right coronary artery has plaque in it, which is an inflammatory process, of course. So sometimes it's hard for people to define what they're feeling. I say, do you feel tired? Do you feel pain? Do you feel sore? Do you have difficulty getting up and moving? If you do move, do you have a problem in doing so? So, I have to ask a lot of other questions to try to get a good picture, to paint a picture of exactly what's going on with them. And of course, at that first visit, we ask a lot of questions. I document everything I can. The blood test will really add to that and allow us to be able to find out what's going on or why these things are happening. But yeah, it's human nature not to understand everything that's going on in your body. I mean, most people don't, even a lot of doctors don't, but to be able to put into words, that's why I ask people, think about it, try to put it into words, give me a sequence of when the problem started, what do you think might have triggered it? Give me a narrative on that so I can understand what your body's been going through since your problem started. It makes it easier to figure out.
Someone's just asking if supplements like turmeric, ginger, or vitamin D actually help reduce inflammation. I get a lot of ads on that.
They can. It depends upon the type. So the other issue I have is that vitamin manufacturers are saying, oh, yeah, this is an anti-inflammatory, or take this and you'll expect that. That doesn't always happen. And in many cases, it doesn't happen because you're trying to throw something at a mechanism that you don't understand. You don't know why it's there or what's causing it. So yes, fish oil does have some anti-inflammatory properties because it decreases prostaglandins, which can irritate you and make you, quote, inflamed. And I don't want to keep using the word inflamed or inflammation in a description of what's causing it. But just like there are non-steroidal anti-inflammatories that may decrease your aches and pains, Motrin, et cetera, and the others, and there are steroids that decrease swelling and inflammation. There are things that may have some benefit, but if you're not changing the cause, that'll never go away.
We got this one not related to inflammation, but one of our viewers said that they got in an argument with their husband about artificial sweeteners. What are your thoughts?
Well, we've mentioned this a bunch of times before. They're not good for you. You're better off with the more natural things, like we talk about agave. It may be that the artificial sweeteners are tricking your brain into thinking that you're not getting, a sugar or a chemical response, but you may very well be. And you don't want to keep people having that desire for a sweet tooth, adding more and more of these chemical artificial sweeteners on board. They're probably worse for you than most things that you might add to your foods. Some people say they're linked with problems with memory, focus, concentration, maybe even dementia. So it's possible. I'd rather people just use the naturals.
All right, up to date on that. And hello to our YouTubers. They're asking to see the. I'll put the link in the description if you guys want to check out the Rumble show from Saturday, because I know.
Does that automatically go up on YouTube?
No, we had that one exclusively to Rumble, but guys, don't worry.
Yeah, we'll pop it up so you can see it. Yeah, big time now. 180,000. I may have to have like T-shirts and hoodies made. 180,000, just so I could walk around. That'd be cool.
All right, guys, I put it in the chat for you. All right, we're good there. We got some baseball comments.
Yeah, some baseball comments. Let's talk about that. I mean, good games. That's what I want to watch. Good games. Great play. We were talking about it when I first came into the studio here, and Ohtani is just like from a different world.
It's insane.
3 home runs in one game and, pitching an amazing game. Besides the fact that you never see in either of the leagues pitchers that are good hitters, and I don't understand why. Maybe they don't want them to get bulky and strong to be able to hit the ball, but there's no reason why they shouldn't be able to hit the ball. And Babe Ruth was famously a great pitcher back in the day, and a spectacular hitter. So there should be more pitchers that understand the movement of the ball maybe better than the other players, and they should be good hitters. But amazing.
I'll say, Ohtani at the plate, the way he like puts down his bat and measures everything perfectly. It's like there's just
whatever it is, he can stand on his head for 10 minutes before he gets up to the plate. Whatever you have to do to get into that zone, and a lot of players do that. But he's a terrific hitter, and he's not the biggest guy in the world, but he hit a 469-foot home run the other day. It's just great mechanics. And yes, there may be something better about certain people that have great focus, great concentration, great perseverance that other players don't have. And did I send you that thing with Pete Rose and Frank Thomas and A-Rod?
Yes.
I've been talking about this all too often because of the demise of our New York team or teams. So Pete Rose, who was a terrific, terrific hitter, 4,200, blah, blah, blah. I mean, an amazing hitter, a hardcore ball player. He never let up, ran hard, slid hard. I was a little bit angry when he ran over Bud Harrelson back in the day on the Mets, because Bud Harrelson was a twig and Pete Rose is like a little freight train. But you got to give the guy credit for being a hardcore player. Charlie Hustle, right? He said he never stood to the same part of the batter's box, twice. And A-Rod and Frank Thomas were like, what? And he said, if I was down in the count, I would move up, move back, close to the plate, away from the plate, depending upon what I think was going to happen or depending upon the pitch. I would choke up. I would do all sorts of different things to make sure I made great contact with the ball, not that constant home run angle swing that everybody does and pops the ball up today. And he would poke in and get the singles. He was clutch. When you needed a single, he'd get a single. Someone's on base, he'd get the single or double, whatever. So I've been passing that around to all my friends over and over again because, the conversation is, do what Pete Rose did. And you'll get those singles and you'll win the games. It's a sin to leave people on base.
That's why I love Jeter. He was so clutch
first,
with
second,
that one.
Loaded base. Guys like that. The clutch players are what you need, and you're not going to make it to the World Series unless you have a clutch team. Unless you have excellent pitching, unless you got guys that could get the singles to get the runs in. You can't rely on swinging the bat like you want to hit the ball out of the park. It's foolish. But
we got a question on shoulder pain. How could I tell if my shoulder pain is from muscle strain or something deeper, like a joint issue? I'm certainly not Ohtani, but I'm feeling it.
You're feeling it, yeah. Well, we all feel that sooner or later. A decent doctor could examine you and look at your range of motion and palpate and press on certain parts of your shoulder, like your biceps tendon, ask you to bring your arm up. If that hurts, then there may be some damage to that tendon or the muscle. Supraspinatus is part of a coordinated movement that tended to allow you to throw a ball and to move around, bring your thumb all the way up the middle of your back. So there are range of motion tests that could tell whether you're restricted in that range of motion because of damage to some of that tissue, ligaments or tendons. But the ultimate perfect picture is the MRI. So I would love to see the MRI and have that tell us exactly where the damage is, where the tear or tears are. Of course, we do the range of motion testing, but it's like saying you're getting some of the information with the range of motion testing, but you're getting a really big picture with the MRI. Then based upon that, we could opt to do PRP or even better, stem cell to create growth and repair in the damaged tissue. So the more information you have at your fingertips, the better you'll do.
And then a follow-up. I've been trying to sleep on my back because sleeping on one side every night, I feel like is causing a lot of shoulder problems for me.
Typically does. If you're rotating and moving onto that shoulder, the weight of your body with your arm up, arm down, you may not be able to get a position to put your arm in that'll make you feel okay. So it depends upon how much damage is there. The other thing, too, is that you really want to see the MRI because you can't tell from physical exam if the tendon or the ligament that attaches to the bone, and the tendon that goes from bone to tendon to muscle, etc., is damaged enough that the muscle's pulling back on that tendon and there's retraction, or the muscle's squeezing and pulling, and the tendon's moving away from the attachment to the bone. Whether there's an avulsion where you're tearing off that tendon from the bone, sometimes with a little bit of piece of bone, or you have enough of a tear to have a retraction. If there's enough of a tear to have a retraction, you've got to go and surgically pull that back together, overlap, and sew those two ends that are separated, and sometimes put down anchors to be able to make sure that you have the strength and stability back. So the MRI would clearly tell you if there's retraction of that tendon because the muscle's pulling it away from where it was.
Oh, I like this question. Can you explain Tommy John surgery? I've always been curious. I understand it's something to do with the tendons, but what exactly?
Yeah,
is going on
so
there?
when the tendons of the middle aspect of your elbow are damaged, they're either going to reroute them, or sometimes they'll take cadaver tendon and attach it to try to make the area stronger. So it depends upon the anatomy of the individual. Some people do need to have the tendon rerouted to create integrity and strength, and a lot of people will come back beautifully from that. So that's a surgery that's been around for many, many years, when Tommy John was one of the first people to have that. One of my friends had that done, and he was a pitcher for the Yankees, and he went from the Yankees to Cleveland to Toronto. He did extremely well after having that done, so I think it's been a lifesaver for a lot of pitchers.
All right, up to date there. Also, just a side note, I was thinking, I was just reading the other day, Ohtani, he's gotten like 2 of them, or it was readjusted. I thought it was a one-time, and if it goes bad, that's it.
Well, you have to look at the physics of the picture. Ball players have strong bones. When they're pitching, they whip that ball, and they're whipping and twisting their wrist. They're doing all sorts of things that are not great for their elbow, and to some extent for their shoulders or their wrist. So if the ligaments that hold bone to bone are just constantly worn or inflamed and damaged, or sometimes frayed, and the tendons that go from muscle to bone are having the same fraying or wear and tear, and you adjust and do the surgery initially, sometimes you've got to go back in and readjust it. It's not that unusual. But it's the ultimate description of an overuse syndrome, where you're whipping that ball, all over the place and trying to make it dance around the plate. That puts a huge amount of strain on those tissues.
All right, a little change up. Haha. Pun intended.
No pun intended, or pun intended. Okay.
Hey, Doc, I feel like I'm always tired, even when I get a full night's sleep. Last night, I went to bed at like 8 o'clock. Felt absolutely exhausted this morning. What could be going on? What do you think?
Well, there's a lot more behind the scenes when you're talking about fatigue than just getting a good night's sleep. So we've heard that getting a good night's sleep forever. It does make sense because your body repairs while you're getting that good, deep REM, rapid eye movement sleep, where you're supposed to be down and out, for 6, 7, 8 hours. If you have a virus, sleep is not going to change the fact that a bug is multiplying and making you feel bad or tired or achy. If you're deficient in B12 or you're low in iron, sleep is not going to change that. So you'd have to correct your B12, maybe using methyl B12. That's a better, more readily available and functional type of B12. Some people don't make a gene that converts, an enzyme that converts regular B12 into methyl B12. You have to look for that in your blood. So correcting vitamins, minerals, hormone decline is not changed when you sleep. So as you get older, you could have low testosterone, DHEA, IGF-1, female hormones. So the sleep part of it is one part of the picture and not the entirety. So yeah, infection, virus, bacteria, etc. Low hormones, low vitamins, heavy metal exposure. There are a lot of things that could affect your sleep and make you feel tired all the time.
We got someone else who said that they wear an Aura ring, and at night it's the app tells them that their heart rate is a little high, and that it's affecting their sleep patterns. Any thoughts on high BPM.
It could be. There are people that are stressed out during the day, but they're moving around and grooving and they're getting their thing done, and it kind of gets pushed aside and your body's kind of working with it. But for some people, they just kind of carry it with them and they can't let it go. So when they go to bed, either they're stressed out and sometimes they're awake and can't get that good deep sleep. And your heart rate, as a result, might typically tend to be higher because of that stress response. Your body's trying to deal with it. Other issues, too. A person who's got too much caffeine in their diet may not feel it during the day, but when they go to bed, their heart rate's faster because the caffeine's there doing that. So heavy metals can also do that. So there are a variety of things that can make your heart rate a little bit faster when it shouldn't need to be. Also, when people do a lot of exercise, you're training your body to open up your blood vessels to push oxygen, vitamins, minerals, and hormones to all your cells. You're also training your body to have a better heart rate because your heart is developing more stamina, more endurance, and your organs and your vessels and your heart starts to understand what you're trying to achieve, so it acclimates to that. And people who do a lot of activity usually have a lower heart rate. So if a person hasn't been doing the exercise, another reason why the heart rate might be elevated.
We got someone that's saying that they have very minimal sleep apnea. They don't snore, but how much could this contribute to daytime fatigue? I've been
Absolutely.
thinking about getting
it's a major component. Of course, people who have really bad sleep apnea that snore like a chainsaw, you're not getting good deep REM sleep because as you start to try to breathe in as you fall asleep, and the membranes inside your nose are vibrating, they get a little swollen, you can't pull that breath in, and then you're either waking up or you're taking a deep gasp of a breath, and you don't get the good, deep, maintained REM sleep. So they start to go to sleep, they come back up and down, they're going back and forth like a sawtooth pattern, and they're not getting the good sleep. So that person might really benefit from using the CPAP machine to be able to push the air into the nose and prevent the snoring and the inflammation so that they can get good deep REM sleep. It can be a world of difference. So that person would probably need the CPAP, whether the mask or the nasal pillows. That would probably help.
And then is adrenal fatigue a real condition or just a trendy diagnosis? I've been hearing things
It's
about
both. There are a lot of people who are not medical doctors that talk about adrenal fatigue. And every person that I've seen that has gone to a non-doctor person are told that they have this stress, adrenal fatigue. You know, it's the same sort of thing, hypothalamic issues, but they're not doctors, so they're not testing for these things. So, you know, if a person's over 40, 50, 60, it's a good bet your DHEA level is going to be lower than it should be. So having a lower DHEA could be the absolute fact of a decrease in your adrenal function. So, but did doctors ever use the word adrenal fatigue? No. They would say you have low DHEA. Because for me, that's a better way to describe something to someone as opposed to adrenal fatigue. But, you know, you can take a cat and whip it around the room and throw it. And, you know, someone catches the cat, oh, they've got adrenal fatigue. It's just as, you know, random as anything. No, and to be fair with cats, you know.
We got some trolls in the chat saying, oh, just take some adrenochrome.
Yeah.
We're on YouTube today, guys. Relax.
Yes. But think of it, you know, for a lot of individuals, when your hormones start to drop, they all drop. It's not you're going to drop one and not the others. In some people, it happens a little bit earlier, in their late teens or 20s. I've seen 18, 20-year-old kids with low T3. That's one of the thyroid hormones. Usually 30s, 40s, 50s, 60s. The older you get, more drop in DHEA, thyroid, testosterone, estrogen, progesterone, IGF-1. IGF-1 controls many things, so that's a big hormone to drop because when you don't have the IGF-1, your hair, your skin, your nails will change, your mood, your memory, focus, your energy, your concentration, your endurance with exercise, your strength, your ability to create, you know, some benefit and some good look for your muscle. That'll change when your hormones are low, but that happens to everybody. Nobody escapes that.
Hey, Doc, thinking about coming in for a measurement of my testosterone, I'm honestly thinking that might be the cause of my bad sleep.
Sure.
Can you go over anything related to that?
Absolutely. So testosterone drops again in usually the 30s, 40s, and 50s. Sometimes you don't know it that much in your 30s because it's dropping a very small amount. But as soon as it gets that big drop, and you want to be at the 800 range, 900 range maybe, you start to drop below the 300 range, 200, 100, your body doesn't feel good. So you're not in good mood. You don't have that good focus, sharpness. You don't get the results from your exercise, your activity, sexual drive changes. So there's a lot that occurs. It's a very important hormone for men and women. Now, men need to be at a range of 7, 8, 900, and women really need to be close to 40 or 50. And overwhelmingly, because traditional medicine doesn't talk about testosterone for women much at all, women will have levels of 5, 7, 10, and not know that there are terrific benefits to it. So for women, we don't give them a shot. We give them a pellet that you take under your tongue, let it dissolve, and that could be 5 milligrams of testosterone, and watch to see how much your memory, focus, mood improve, sexual drive and function improves, fat burning. So you want to keep, for women, that level between 30, 40, and 50. Those are great numbers for testosterone. But again, men need to be 7, 8, 900 or so.
Oh, this is a great one. The video of the older lady you played on Saturday blew my mind. I need my hair to grow like that. Give me bangs, doctor.
Janice is such a sweet lady. Very, very sweet. Very engaging, great conversation. She had lost her husband, I think, a while back, but she would travel back and forth to Italy, very worldly, and I would have conversations with her about all sorts of things. Of course, because we're Italian, mostly food, how good the food is here, food is there, how great the Stanley Tucci TV series is, and all of my patients talk about that. But, you can't escape the outer aging, the inner aging that occurs, but you can fix things to make your body do better. If you're deficient in vitamins, minerals, hormones, you bring them back. Your body will do better like you did 10 or 15 years ago. In using stem cell therapy for her, she had dramatic improvement. She was falling down and was having these stroke episodes. And, doctors in the hospital, have these ideas and these comments about stroke. The mini stroke occurs and the big one's right around the corner. You have a couple of mini strokes, it's just going to happen. So you've got to stop the process, reverse it. Do not let the big stroke occur. And that's why we love the comprehensive approach to stroke as I do it, fixing vitamins, minerals, hormones, exercise, eat right, and stem cell. Because you're putting brand new cells back into the brain where those cells are damaged or dying and are going to die more. So if you put new cells into the area, they take over and they create great repair. But it's the entire picture. It's not just one thing. And she had wonderful results. We had a lovely woman from Japan who actually brought her mother. And she was in her 70s at the time we did her stem cell. And she brought the mother for stem. So the mother was in her 90s, but, very impeccably dressed and very, as you might imagine someone from Japan would be. A lovely outfit, just kind of very extremely well put together. The daughter had lost her eyebrows to some extent, some hair on her forehead. She had trigeminal neuralgia, really bad pain along the trigeminal nerve. And we did stem intravenous, nasal, and we just injected across the scalp, her eyebrows. And over the course of like 3 or 4 weeks, her eyebrows were coming back. Her hair came back, and it took probably 2 months, and she looked like she did probably 15 years ago. And she had wonderful results. The trigeminal neuralgia was gone by like the second week. So pretty amazing as to how your body can repair itself. And I promised I had to take a picture of my mom. We did her stem in April, and the hair behind her back of her head from ear to ear is black. So she has all this black hair coming in. She's 96 on November 17th, but she's got all this black hair coming in. with a salt and pepper hair across the top. So
And I think we're bringing my grandma in, so maybe
there we go.
Maybe we'll monitor her. Maybe we'll have her on
Exactly.
the program.
Yep. Exactly. We'd love to see it. It's unusual to see, but we love to see any benefit or any increment of benefit from STEM.
We got a YouTuber here. I'm going through menopause. It's rough. Does hormone therapy help with hot flashes?
Yeah, absolutely. So what you typically hear is that when doctors want to correct your hormones, they'll just give you some pre-made estrogen-progesterone combination. Premarin, pregnant mare's urine, is a common one, but there may be some issue or side effect with that. I'd rather use the bioidentical plant extract. But before doing that with every woman I've ever seen that has a decline in estrogen, progesterone, even decline in testosterone, we'll give them DHEA. DHEA, dihydroepiandrosterone, is a vitamin, and it helps to balance and stabilize and make a little bit of estrogen, progesterone, and testosterone. So sometimes all a woman needs to do, if it's relatively early on, or even if it's further on, is correct the DHEA level. We put that on board once we see the blood test, and then the patient writes down a list of all their benefits or symptom changes. We recheck the blood. If the DHEA is in a good range, you might see the estrogen, progesterone, testosterone go back to that good range for a while. It may be good for 5 years just by doing that, maybe more. So it's not always that you have to run to use the full-blown estrogen, progesterone creams or capsules. It's nice to see that correcting one simple thing without any side effect or risk will give you a far better function.
This is a follow-up on that. How do you decide between estrogen only and combination therapy?
Well, your body's always had all of them, so you want to be as true to your body as it's always been. So, perfect case in point, if your thyroid levels are low, T3 and T4, and your TSH is high, because your brain is asking for more hormone production from your thyroid gland in your neck, if you just give T4, you're not fully correcting your thyroid. You're giving one hormone. And we've seen this and have tested people that are only on T4 and their T3 is low. You give them a little bit of T3, or you give them a thyroid that has T3 and T4, and all of a sudden, all these other improvements occur. So you have to give your body what it's always had. And when we talk about vitamins, minerals, and hormones, we're giving your body what it's always had. Same thing with NAD and peptides. Same thing with sermorelin helping to make your own IGF-1, which is the active component of growth hormone, to repair those areas that are suffering because they've been missing it. So we're just walking your body back with something that you've always had. Can't get more sensible than that.
What age do hormone levels typically drop?
Everybody's different. As I mentioned a moment ago, we've had 18, 20-year-olds that have the thyroid decline, T3. That's not very common, but I've seen it. And I would look for if a person's got appropriate symptoms and issues that I think are correlated with the hormone decline. But usually late 30s, 40s, 50s, that's when it starts to happen. If women are looking at, my mom went into menopause at 50. Hormones were dropping before full-blown menopause because the definition of menopause is no hormone for a year, or no period for a year, rather. So you start to see those hormones drop probably 10 years, maybe a little bit longer before the period's totally gone. So you have to start tracking. And then as you track and you give a little DHEA, you're back to normal. So that's how we do the correction. Same with the IGF-1. You start correcting, you watch to see the benefits come back.
Someone wants to know what the deal is with HRT.
HRT is hormone replacement therapy. So women will.
Okay, wait. There was a follow up on that. I didn't realize what HRT was.
Yeah.
Is HRT about reversing aging or just helping people feel more like themselves?
So HRT is a variety of things. It helps to get rid of symptoms that have occurred as a result of loss of hormone. So when your hormones decline, just as your neurotransmitters might decline, your body's not working the way that it did before. If you correct vitamins, minerals, hormones, and exercise, and you have better function, you could say that it does have some anti-aging potential. And the women who have low estrogen progesterone, who develop osteoporosis, that's an age-related hormone decline, so that's bad. So that's an age-related problem. But with correcting vitamin D, some testosterone, and those hormones, you can see your bones do a great deal better. So you're reversing a bad process. So I look at hormones as giving you back what you've always had to regain the benefit you had and make you stronger going forward, so you don't develop the osteoporosis, you don't develop all of the age-related progressions.
Doctor, I was carrying a mini fridge up. Oh, I don't like where this is going. A mini fridge up the stairs. I destroyed my back. I don't know if it's a slip disc, a muscle issue, a nerve issue. Where do I start?
So a doctor who's good at examining you could make a decent idea, have a decent idea as to which tissues involved. If we press upon your muscle and you have pain where I press in on your muscle without you moving or changing position, that could be in part muscle, which usually that's part of it. It's hard to separate and just have a muscle without ligament tendon issue or without affecting rotation of your spine to have your vertebrae rotate out of position, which is called by chiropractors subluxation, somatic dysfunction. Depending upon the age and depending upon what your discs are like, yeah, you could already have some disc wear and tear and not have horrible pain, but then putting that pressure and more grinding on the disc can cause it to bulge and hit the nerve roots, so that could be an added issue. So it could be some muscle, some ligament, tendon, some disc degeneration. If it's early on, you wouldn't see arthritis of the spine. That's a late stage issue of your spine or your back. But again, the only true answer is MRI. It shows you everything. And then from that, we could take the steps to help to improve the picture. Some people that are stuck and the muscle's so tight, a muscle relaxant might be the thing to do, stretching, massage. Sometimes we inject, but depends upon the presentation.
Hold on, I've been kicked out of YouTube. Just give me a moment there, Doc.
Kicked out of YouTube?
Come on.
Yeah, sometimes the electronics are a little bit kooky.
Just making sure we're still live. We've had a little bit of today was a weird day for us.
A little bit of a glitch.
A little bit.
But glitches come and go.
Okay, we're good. We're back.
There we are.
Is sciatica always caused by herniated disc, or can it come from other things?
Sciatica can be caused by different things. So, your spinal cord is a big fat cord that runs down the inside of your spine. It branches off to different nerve roots. The sciatic notch is an area in the bone where the sciatic nerve comes from the cord, goes underneath the bone. You can see this little notch here. And that sciatic nerve can run through the piriformis, above or below the piriformis muscle. Sometimes rotation of the hip will put pressure and muscle spasm onto the sciatic nerve without a herniated disc. Sometimes the piriformis muscle spasm puts pressure on it. So there are a variety of different things that can put pressure on that nerve. Yet also, a disc degeneration or herniation could put a lot of pressure on that as well.
Oh, this is a follow-up from the mini fridge man saying that he doesn't think he could handle an MRI with the pain he's in.
With the pain? He couldn't handle it because of the pain?
I guess laying down. There's stand-up MRIs, though, right?
Yeah, there's a bunch of them all throughout Long Island and I think into Westchester, where you walk into the facility and the device is really relatively wide open. There's a little lip that you stand on, and you could just lean back and you could be at 15 degrees off straight, vertical, and they may tilt you back a little bit and do the MRI. For shoulders, they may have you stand sideways, put your arm through a little bit of a device and get a more focused picture. So the stand-up MRIs we typically recommend all the time because they're really good. But yeah, you don't want to get stuck into that very, very narrow tube to be able to, be uncomfortable and claustrophobic. But the stand-up MRIs are great. We use them all the time. If you were to use an anti-inflammatory and that helps to make the pain go away, that's one thing. But if you're using that and you're not getting better, then it's a more progressed, cause of the problem. So we'd have to figure that out.
Back to our lovely interview we played on Saturday. I keep forgetting her name.
Janice.
Why does hair loss seem so common now for both men and women?
It's a good question, but remember now there's a lot in the environment. There are a lot of things that are bad for the body, a lot of chemicals and foods, a lot of things going on that didn't happen before. We also know if you look at men and women in the last 50, 60, 70 years, their hormone levels, without anything else really changing, are a lot lower than they were. They say that men's testosterone levels are 35% lower than they were in prior generations. So there are reasons for this. I'm sure the bisphenol A and plastics and chemicals and heavy metals, etc., I think have a great deal to do with that. So we have to look at that picture and see exactly what's occurring. Certain men, they've got a genetic issue where you lose hair down the center and down the back of your head, and that may be genetic. But for women, that hasn't really been documented. And I've seen women that have just, thinner hair. With a lot of men and women, we've done both PRP to inject into the scalp to try to stimulate a healing response to get a little stronger follicle. Of course, we use vitamins and minerals all the time. And for men and women, we've done stem cell therapy where we inject it into their scalp to create growth and repair. We also use collagen peptides. We recommend good protein powders to get more nutrients that are beneficial to your hair, to the spot. For some people and some men that have high testosterone, you want to block the dihydrotestosterone because that can affect and make you lose hair. So there's a lot going on.
We've got a comment here. I think this is regarding the hormones in men and women. It must be the lack of cigarette smoking. Got to get those numbers back up. This might be Montauk Mike over here. I'm not 100% sure.
I never know. He's always calls in with a good comment here and there. But yeah, your body goes through a lot of changes. And think of it, there's more garbage in food now than ever before. There's so much more going on. And in medications, I think, will play a role. So we just have to be a little more diligent when we do a workup and figure out why it's there.
I got this one. Have you noticed the same companies that make regular shampoos are also the, quote, hair growth supplements that are made? Seems interesting. Listen,
there's a lot of that around.
Sound like me with the tinfoil hat.
Yeah, there's a company that was bought by a very big injectable manufacturer to deal with side effects from the injection. I can get you some clarity on the exact names of those two companies next time we do the show, but that was in the medical news. Didn't reach big-time news, but because of all the side effects and issues with some of these things, one big company bought another company because that's the company that's going to make money trying to fix those problems.
Slightly off topic, but doctor, I just found out that Pellegrino was bought out by Nestle like 15, 20 years ago.
Really?
Nestle. Makes me think. Makes me wonder.
Yep. You have to kind of look at these things because there are big companies out there who are just looking at their bottom line and, changing product. I mean, products have changed for the worse, I think, over the years. And there are substances like Roundup still in stores to spray your weeds and give you cancer. So you have to be really diligent and aware of what you're purchasing and what you're using around your home and your own personal environment. It's never been so as important as it is now to be able to make sure that you're looking at all of these things.
I think we're up to date.
Okay.
Let's see.
A lot of good info. We're at, what, 53 minutes? That's not bad.
Yeah, it goes quick, Doc.
It goes super fast. Oh, let's put a little plug in for Moolah Farm. One of my favorite local farms.
I almost met him yesterday.
That does their Sunday in Huntington at the market. They do another one in Garden City on Saturday. At some point, they get down to Long Beach. But great quality organic food, eggs, meats, chicken. The milk is unbelievable. I would bet that you would never drink other milk again once you drink this because it's just delicious. No chemicals in it. Honey butter, Greek yogurt. Their ice cream is phenomenal. And they have raisin bread. They have all sorts of good stuff. So I would check them out. Moolah Farm, you could look them up online. www.moolafarm.org. And they're on Instagram. So learn about where you can get some really good quality food and get away from all the stuff that's has chemicals in it. You know, eggs should not look like they do.
They all look the same.
In regular supermarkets.
They all look the same.
Eggs are supposed to be good looking and vibrant when you crack it open. You know, the yolk should be vibrant. I used to go to a place, and many times as I go out in the island, I'll go out to Miloski's Poultry Farm, Miloski, Miloski's Poultry Farm. I think it's on 347, right past East Wind Spa. They've got duck eggs that are amazing, double yolk eggs, very creamy. So you've got to find the best places to buy your foods and do that. You're putting stuff in your body every day. You want to have good stuff there.
Someone said just move to Italy, Doc.
Yeah.
Listen.
Wouldn't be a bad idea. The Garden City office, 516-794-0404. The website, drcalapai.com, drcalapai.com. Send us your questions, email us, etc. Call us. We'd love to help you out.
Don't forget Rumble.
That's right, Rumble. Watch us on Rumble. Big Rumble show coming up this Saturday.
Let's go.
Hopefully keep surpassing those numbers. 180,000 views. We'll do our best to break 200.
Even, you know, our personal Rumble today, we got 7,700 views, which is
awesome.
Also a record. Let's go.
That's it.
Making moves.
Thank you so much, people. Enjoy the day. God bless you.